Now to India and a worrying COVID-19 development emerging there. A double mutant variant has been discovered in addition to several others. Now the Ministry of Health has detected a staggering 771 variants across 18 separate states in India. And for more on this, I'm joined by our India correspondent, Bundhun. Hi there, Rebecca. So here in South Africa, we have a triple mutant. Our 501YV2 variant, it has mutated on a number of fronts. So how concerned are Indian authorities about this double mutant variant? Is there any indication that it is more deadly, more transmissible than any of the other variants in India?
So the Health Ministry has announced that it has found this new double mutant variant in India, and what it's saying is that there's not actually enough evidence to say that this is linked to the rise in cases that we're seeing in India at the moment. Clearly, it's a big concern, however, and some medical experts do say that it is more infectious when you have such a double mutant variant. India is currently seeing quite a sharp rise in cases after it saw a dip towards the end of the year. Now, today, for example, India reported more than 47,000 confirmed new infections in the past 24 hours. That's a record high spike for this year. It's still down from last year's peaks when in September India was approaching some 100,000 new cases a day. But clearly these numbers are now rising rapidly in India, and it's being described as an emerging second wave of the virus. Some health experts are saying that new variants could have a role to play, and India has now announced officially that there is this new mutant variant, and also that it found more than 700 cases of several other variants which have been discovered in other countries. It was already known that these were present in India, including hundreds of cases of what's being described as the UK variant, the one that was first discovered there, more than 30 instances of the South Africa discovered variant, and one from Brazil. So this is clearly a big concern, given that the way these cases are rising. A lot of officials are saying that one of the main reasons behind the spike in cases in India is because people are not following COVID-19 precautions, such as wearing masks and social distancing. This also comes as it marks the one-year anniversary today since when India announced that very, very strict nationwide lockdown last year, which came into effect just a few hours after it was announced by India's Prime Minister, Narendra Modi. There were very, very strict restrictions, and then, of course, that eased up throughout the year, and now the economy has steadily opening up. But now India is seeing this fresh rise in the number of cases, and there are obviously concerns about these new variants that are coming through and the way the virus is spreading. Yeah, and those new variants, certainly the variant that was first identified here in South Africa, actually caused our second wave to be even worse. It was more transmissible and it moved more quickly through society. At the same time, we also know that a vaccine rollout is crucial, because the more you vaccinate, the more you prevent the disease moving and mutating. How is India's vaccination program going? Yes, that's right. So the vaccine drive in India started in mid-January. First of all, it was opened only to healthcare workers and other frontline workers, such as the police and armed forces. Then at the beginning of this month, it opened up to the over 60s and the over 45s with comorbidities. And now this week, the Indian government has announced that from the 1st of April, it will open up to the over 45s. Everybody over the age of 45 will be eligible to go and have that jab. There are two vaccines that are available here in India. The AstraZeneca vaccine, which is being manufactured locally by the Serum Institute of India, and there's also a homegrown jab made by Bharat Biotech. Now, the vaccine drive has actually got off to a slower than expected start, especially at the beginning when there was a lot of vaccine hesitancy, particularly over concerns related to that homegrown jab, when there wasn't data that was publicly available. And the fact fact that it is still only available to a limited number of people in the population. So when you're talking about a population of 1.3 billion people in the country, so far only 50 million vaccinations have been conducted. So there's still a long way to go.
A long way to go, absolutely.
I mean, really,
and that is the challenge, isn't it?
Population.
Absolutely. Thank you so much,
that's
Rebecca Bundhun. Thank you very much. Rebecca Bundhun coming to us live from India.